I am Professor Manoj Kumar Sharma, Department of Clinical Psychology, works in the area of substance use and behavioral addiction, NIMHANS, Bangalore. Performance enhancement drugs include not only the illegal substances or prescription drugs, but it also includes various products which are available in the common market. The main aim of taking these performance enhancement drugs, especially among the athletes, is to work on their performance, to work on their fatigue, to enhance muscle strength, as well as to work on their alertness and other component which can enhance their performance in the sport field. But use of these substances do leads to various kinds of side effects also, which may include nausea, vomiting, dizziness. In some of the cases it may include disturbance in memory, or it will lead to complaints of weakness in the body, and sometimes people reports more exhaustion after taking of these substances because of regular use leads to development of dependence on these substances, as well as it leads to other physical issues which may be cardiac or liver related issues also. So that may be the future, or that may be the long term impact of these drugs on the human body. But the need always felt like, why do people use substances? So the reasons are common: to work on their performance, and as well as it do leads to short term side effects as well as long term. But the people makes a decision, or the user makes a decision, that rather than concentrating on minimizing or to overcome these side effects, they wanted to work on their performance, because that's the things they want, that will lead to more recognitions and other benefits to them, and that's become the maintaining reasons for taking these substances. But though there are strict mechanisms are available to detect this kind of substances among athletes, but some of the athletes or some of the users do also go undetected despite having all these stringent measure for assessment or screening of doping. So why does this undetection happens? One is, athletes are quite familiar with pharmacokinetics or the pharmacology of various substances. So if they are planning to mask or to go undetected in the screening for doping, either they use some masked substances, like overdose of caffeine also helps them to mask the primary substances, which could be amphetamine or any other drugs, or they may use other available drugs also. Secondly, the period of giving sample is also matters a lot, the way that the time the sample was given for screening. And more or less the undetection also is get affected by window of detection when we are assessing their use of substances, and the test sensitivity, the type of test we are using to screen out doping in these athletes. The third comes doping regime, which kind of doping regime we are using to uh, use or screen these substances, as well as the predictability of the test. If these four tests, if already athletes plans to overlook or to manage all this testing regime, which may be test sensitivity, which may be window of detection, which may be uh, test predictability or doping regime, if he can scheme and overcome all these domains, he may go undetected also. And sometimes people do various kind of synthetic substances which also goes undetected in the doping screening. So that's the thing, because these are the available mechanism which people sometimes use to go undetected, as well as to improve their performance in the sports fields. And what person can do, I think, as a in the sports area, the main purpose is to work with these athletes, tell them the long term and the short-term consequences of this use of these substances on their performance. Second, help them to develop a discrepancy in terms of if they use or continue to use these substances, how it will benefit and produce the consequences. Vice versa, if they decide to not to use, what are the positive things will happen in their life and what are the negative things will happen in their life. And with this kind of grid, we help the person to take a decision about himself or herself, because substance use or use of these banned substances affects both male athletes as well as female athletes also, but the nature of manifestation will vary. So with development of this grid of positives and negative of continuation of use of these banned substances, as well as positive and negative of not to use these substances, and then we ask them to athletes which one he or she wants to increase, and positively we work with the client to have more positive benefits, more positive techniques to improve their performance without use of these substances, as well as the minimize the consequences of use of any one of these substances. If that happens, that will allow the persons to take a decision. Thirdly, some of the athletes, because of peer pressures, because of other environmental reasons, they initially shows resistance to change or to be without substances in the sports fields. I think rather than uh, challenging their opinion, we have to sit with them. We have to allow allow them to ventilate their reasons for use of substances and help them to change in a change the pattern of use of substance and enjoy the sports fields without the use of substances. And the last is enhance their self efficacy, that he or she can also perform very good well in the sports field. And what they have to do, they have to work on their sporting techniques rather than use of substances to improve their performance. So enhance their self efficacy helps them to build up a discrepancy as well as take the right decision, as well as to work on their resistance to change, as well as motivate them for a sports healthy sport style without the use of these performance enhancement drugs. Most of the drugs which are uh, hormonal related growth properties, they have any steroids or any anabolics and other things are there. These are the completely banned drugs in the according to the performance enhancement drugs in the WADA area, according to WADA. As well as some of the drugs people are prescribed for therapeutic use for XYZ reasons, but if it remains in the therapeutic dose, it helps the persons to overcome their physical issues. But they start exaggerating the use of those therapeutic doses, it may also comes in the range of banned substances under performance enhancement drugs. Thank you.